Hello, and congratulations. You are now about 10 weeks out from your shoulder replacement surgery. At this point, based on how you are doing at your most recent follow up visit, I will usually allow you to begin resuming some of your regular activities. This may include golf, racket sports, and your regular workouts. For golf, I generally recommend starting with chipping and your short game first. From there, you can gradually progress to larger clubs over the next 1 to 2 months. Your ability to return to these activities will depend on your current motion, comfort level, and overall progress. It is also entirely normal to still feel weak at this stage. Strength often takes much longer to return than motion. In fact, your strength and overall shoulder function can continue improving for well over a year after surgery. Regarding how much weight you can lift, many surgeons advise avoiding more than 20 pounds overhead after shoulder replacement. I do not use this as a strict rule. The truth is, that number is based more on expert opinion than strong scientific evidence. Ultimately, you will have to listen to your body and do what feels comfortable. That being said, you now have an artificial shoulder, and it is important to take care of it. To maximize the lifetime of your implants, I generally recommend avoiding heavy bench press and heavy shoulder press exercises. Instead, I usually advise lifting lighter weights with higher repetitions rather than doing short sets with very heavy weight. By now, I have also likely discussed with you whether it is appropriate to transition to a home exercise program. If formal physical therapy is still helpful at this stage, then by all means, continue. But if you reach a point where you feel comfortable doing your stretching and strengthening exercises on your own, it is okay to stop formal therapy and continue with a home program. As I mentioned earlier, your motion and strength can continue to improve for more than a year after surgery. If you choose to do a home program, I recommend dedicating 2 to 3 days per week to strengthening. You do not need to strengthen every day. In fact, I would encourage you to stretch daily, but give your shoulder a couple of days of rest from strengthening each week to allow proper recovery. Sometimes doing too much can actually create problems. I will plan to see you back at your regularly scheduled appointment. Please remember that once you have a shoulder replacement, it is very important to have routine follow up visits and x rays as recommended by my team. I usually advise x rays annually for the first 2 years and then again at 5, 10, and 15 years after surgery. Please also continue to fill out the standardized questionnaires that are being sent. I do check these and I use these to allow for research on how I can help patients continue to improve. Filling these forms out is greatly appreciated. If you have any questions or concerns at all, please do not hesitate to contact my office. I look forward to your future visit.